Treatments for criminality. Why do we treat offenders? Punishment for offenders is commonly used within the justice system. This may include being sent to prison, being given fines, or undertaking community service. Over the past 2 decades, there's been an increase in the inclusion for treatments of offenders in addition to the punishment of their offence. The majority of treatments for offenders focus on psychological techniques and behaviour treatments. A number of biological treatments have also been identified. The effectiveness of these treatments vary. Why do we treat offenders? Punishment teaches offenders that there are consequences to their behaviour. It aims to act as a deterrent by restricting activities and, if they are sent to prison, by removing access to the community. Punishment does not, however, teach offenders how to act differently. Some offences may be committed because the offender is lacking skills to deal with different situations or because they have learned to associate offending with certain positive outcomes. As a result, punishment cannot be the only solution to resolving offending. Treating offenders aim to identify the problem behaviours and the root causes of such behaviours, and teach offenders non-offending ways to deal with their problems. Treatment is preordainedly undertaken by forensic psychologists or trained staff who have the skills acquired to provide treatment to the offenders. If the staff are not psychologists, then they are usually supervised by psychologists. Offenders may receive treatment in the community or prisons. Principles for each treatment are the same. The extent of the treatment may differ depending on the severity of the offence and the risk of reoffending. Biological treatment for criminality, hormones and drug treatment. Dopamine and aggression. High levels of dopamine have been found to increase aggression. Dopamine affects the reward system in the brain, which may result in aggressive behavior. Aggression activates the release of dopamine and generates a rewarding feeling in the individual. Acting aggressively causes a rewarding feeling. Amphetamines increase the amount of dopamine. Randolph and Morkin, 1966, injected rats with amphetamines, which increased dopamine, leading to aggression, isolation. This shows how dopamine has an impact on psychotic symptoms. Dopamine antagonists. Dopamine antagonists are chemicals that reduce the level of dopamine in the brain, which in turn reduce aggressive behavior. Purdon is an antipsychotic used to treat schizophrenia, which also reduces the level of dopamine in the brain. It works by blocking the receptors in the brain on which dopamine acts. This prevents access to dopamine activity, which has a positive effect in reducing aggression. This can reduce irritability and decrease psychotic symptoms. Supporting research. Lee, Blanc et al. 2005. They used randomized clinical trials to investigate the effect of risperidone on aggression among adolescent boys. They used 163 adolescent boys who were allocated to either a placebo or risperidone condition. All participants had an IQ below average. Findings. The study found after 6 weeks, those who were treated with risperidone displayed a 5.64% reduction in aggression compared to those who were on a placebo. Conclusion. Risperidone is effective in reducing aggression. This is because risperidone decreases dopamine levels in the brain. Strengths of this study is that it was significant. There was a 0.0001 probability used, and it had clinical significance as the reduction in aggression score among the risperidone group at the end of the 6 weeks compared to the control group. However, a weakness of the study is cause and effect. All participants had a low IQ. Could low IQ be a cause for criminality as they're more prone to social adversity? Serotonin and SSRIs. Serotonin is responsible for maintaining mood balance. Serotonin levels can be increased by the drug treatment selective serotonin reuptake inhibitors, or SSRIs. SSRIs are a form of antidepressant medications. After carrying a message in the brain, serotonin is usually absorbed by a nerve cell. This is known as reuptake. Serotonin works by blocking inhibiting this reuptake. This results in more serotonin being available to pass further messages between neurons. Supporting research. Coccaro and kavoussi, 1977. Fluoxetine is a type of SSR. Aim. They wanted to investigate the influence of fluoxetine on impulsive aggressive behavior. Participants. Individuals with personality disorders with a history of aggression who did not have major depressive, bipolar, or schizophrenia. This is a controlled sample. This is a strength, as we are trying to control for extraneous variables. Procedure. A number of behavior rating scales were used to monitor the level of aggression displayed by the participants over a 3-month period. A placebo group was used in comparison findings. The study found that fluoxetine resulted in a substantial reduction in aggression scores on irritability at 2-month stage and aggression at the 3rd-month stage. This was not observed in the placebo group. Conclusion: fluoxetine and SSRIs had a positive effect on reducing aggression among impulsive aggressive individuals with personality disorders. Side effects: in a review of studies, 62 sexual offenders in Watson Prison taking fluoxetine reported a reduced frequency in sexual thoughts and excitability. This is from Hodgkin and Winder, 2012. The side effects of drowsiness, constipation, and nausea were also reported. Lynes-Vinsky et al. 2012. Testosterone. Testosterone is a hormone found both in men and women, but there's higher levels in men. It plays a key role in development of male reproductive tissue and is required to maintain muscle strength and bone density. Elevated levels of testosterone has been documented among individuals with a history of aggression. Medroxyprogesterone acetate, or MPA. This is what I will be referring to it as for the rest of the video. The administration of female hormone, MPA, which decreases the functioning of testosterone, has been investigated as a way of reducing testosterone in males. MPA is a chemical agent, also known as an anti-androgen, which breaks down and eliminates testosterone and inhibits the production of luteinizing hormone through the pituitary gland, which in turn inhibits or prevents the production of testosterone. MPA also produces significant side effects, including breast enlargement, osteoporosis, and depression. This means an individual is more likely to decline this treatment than other treatments. Supporting research: Lucien, Purdon, and Pavlou, 1977. Lucien, Purdon, and Pavlou, 1977, found that the administration of MPA resulted in marked reduction in outwardly directed anger among all 8 participants within the study. However, participants were non-aggressive men, so their findings are hard to generalize between aggressive individuals. Strengths of hormones and drugs to treat criminality. There's lots of supporting research. I suggest that you know one of these supporting research in depth, with strengths and weakness. Such study investigate the effects of drug treatments on aggression, often use placebo-controlled trials in participants which do not know what group they're allocated to. This reduces the likelihood of demand characteristics, making the data more reliable. Drug treatments are direct and target the root cause of aggression, lack of or too much of a hormone, and drug treatments are quick to work. Much of the guidance used for hormones treatment, especially in relation to risperidone, provides guidance that medication should not be used alone to treat criminality. The use of drug treatments should be used as a form of a wider intervention that also teaches individuals to recognize and manage their anger. This suggests that drug treatment on its own is not sufficient to treat aggression. It's also necessary to sometimes have a prolonged drug treatment before it has an effect on behavior can be observed. For example, it can take up to 4 weeks for SSRIs to have a noticeable effect on an individual. This can affect the medication's compliance, with the potential for people to not take medications consistently, or if they do not see an effect, they may stop taking it. This reduces the effectiveness of drug treatment. Physical side effects of hormone treatments. This means treatments are not right or suitable for everyone, displaying aggression, due to ongoing medical conditions or because of side effects of being too severe to warrant the continuing of the medication. The cognitive treatment of criminality. Anger management. Anger management. A common application of CBT for offenders is anger management. Endorsed by Raymond Coccaro since the 1970s, Coccaro describes anger as a strong emotion that has an impact on a person's physiology, behavior, and cognition. Anger management teaches relaxation techniques to deal with the physiological response to anger, for example, increased heart rate, cognitive reconstruction to restrain thought patterns, and timeout, or assertive training to deal with the behavior of anger. The primary aim of anger management is to help offenders control and manage their anger so individuals commit less crimes. It aims to identify triggers so they can be avoided or managed going forward. Techniques seek to change how both the offenders think about their behavior and their behavior, Anger management programs can be undergone in prisons, voluntary or mandatory, via their sentence. It can also take place in the community and be given instead of a custodial. It's usually done in small groups for about 10 sessions. The offenders may be asked to complete anger diaries. They will complete this every time they feel anger. With support from a therapist, they will start to recognize triggers for their anger and be in a position to evaluate which anger management techniques are effective for them in specific situations. There are 3 steps of anger management. Step 1. Cognitive preparation. The offender identifies situations that may provoke anger so they can recognize when aggressive outbursts may occur. Thought patterns are challenged. They also consider negative consequences that may occur due to their anger. Step 2. Skills acquisition. New coping skills are learned to help deal with anger-provoking situations such as relaxation, avoidance, social skills, alertness, and conflict resolution. As anger is a normal emotion experienced by everyone, offenders are not taught to be fearful of becoming angry. Instead, an emphasis is on giving the offender the skills they need so they can control their anger. Step 3. Application practice. Offenders role-play a variety of scenarios to practice their new skills and to control anger. These are conducted in controlled environments so offenders feel safe and untrained individuals are not to expose them to a risk of harm. Supporting research, Ireland 2004 procedure, they assessed 50 young male prisoners on an anger management course with 37 control prisoners. They found that 92% of prisoners showed an improvement in their anger management, showing how anger management can be effective treatment of criminality. However, there is a problem with this study. Offenders may be dishonest on psychometric assessments measuring anger, and they may try to show that they have either improved their anger management skills or minimize their anger experience in the first place, as they use self-reporting data and it's not exclusive to the treatment of offenders. Offenders have a greater incentive to lie by looking good for parole or by looking good to the public. Sense of using anger management to treat criminality. Now, anger management has been shown to be effective to treat criminals who have an anger issue. However, it's only effective to treat criminals who have an anger issue. Not all criminals commit crimes because they are angry. For example, psychopaths. Before attending anger management, offenders will be interviewed to assess whether this would be a suitable treatment for them. It's also been shown to be effective for those who are motivated to change their behavior, who are committed to the program. House et al. 2005. Direct. Treatments aims to tackle the root cause of the issue, establishing when and why the individual becomes angry, and this allows for long-term changes to be made. Effective. Holbrook 1997. It has been found in a group of 26 offenders that were following an anger management program to have a significant reduction in vengeance scores. Side effects. Due to lack of medication needed with this type of treatment has no side effects. Weaknesses. As stated before, anger management does not work for all offences, as not all offences are violent ones. For example, robbing because you need food or money. Slow. It takes 10 sessions, which could take place weekly, meaning offenders do not have the tools necessary to limit their anger in the meantime. Relapse. There is little evidence that anger management programs actually reduce the rate of reoffending due to a limited correlation between anger management and committing crimes. This is likely due to social factors like poverty. Ethical. Can be seen as a form of social control, getting the individual to behave the same way that is deemed socially acceptable on the basis of a therapist. Type of person. Anger management only works if the offender wants the treatment and is motivated to have it. Anger management programs can also have undesirable effects on people. For example, psychopaths can use the skills they have learned to their advantage.